Welcome to our session on comparing plans. My name is Aaliyah McKinley, and I'm the Director of Community Outreach and Education at the Asclepius Initiative. First, I want to welcome you to the Asclepius Initiative. You might be wondering about our name, as it certainly is unique. Asclepius comes from Greek mythology and it represents medicine and healing. And our goal of the Asclepius Initiative is to raise awareness and promote change to make continuous, high quality, affordable healthcare coverage a reality for all. Perhaps you started a new job with health benefits, or it's time to renew your coverage during an open enrollment period, or maybe you're self employed and looking on the marketplace for coverage for yourself and your family. If you have employer sponsored coverage or are shopping for health insurance on the marketplace, the options can feel confusing or overwhelming. How do you figure out which plan will best meet your needs? What kinds of things should you be thinking about? Healthcare coverage is really complicated. It can help to start by figuring out what your needs and options are. So, here are some questions to keep in mind. What types of coverage are available to me? Is the plan an HMO, a PPO, or another type of coverage? How likely is it that I'll have healthcare expenses during the covered benefit period? Yeah, we're being asked to predict the future here to some extent, but this is how insurance always works. Do I qualify for subsidies or cost sharing reductions, which are only available on the marketplace? Who in my household needs to be insured? What's my health status and the health status of those in my household? Do my household members or I have any chronic health conditions or prescriptions that will affect my annual healthcare costs? Am I having any medical or emotional symptoms for which I do or will need evaluation and possible treatment? Will I need care outside of where I live? Will I or others in my household become Medicare eligible within the plan year? Does the plan have a flexible spending account, an FSA, a health savings account, an HSA, or a health reimbursement arrangement, or HRA, attached? Health savings programs have one main thing in common. They are ways to use money on which you do not pay taxes to pay for qualified healthcare expenses. The conditions under which you can get them and exactly how they work vary. These programs all allow you to pay for qualified healthcare expenses with tax free money, i.e., dollars on which you do not pay income taxes. However, they differ in who contributes to and controls the funds. The amounts which you or your employer can contribute historically have changed from one year to the next as determined by the IRS. Flexible Spending Account, or FSA. You and or your employer can contribute to an FSA. There's an annual cap, $3,400 in 2026, on the amount that can be contributed by an individual or on one's behalf. FSAs are considered use it or lose it funds, although a certain amount may be able to be rolled over from one year to the next, $680 in 2026. FSA funds cannot be invested and do not earn interest. Unused FSA funds are returned to the employer. Health savings accounts, or HSAs. HSA savings accounts can be offered by an employer or available with certain marketplace plans. Similar to FSAs, they can lower healthcare costs by using untaxed money to pay for deductibles, co-payments, co-insurance, medications, and other qualified healthcare expenses. They generally may not be used to pay premiums. They can be rolled over from year to year, and they remain with the employee upon termination of employment. Total annual HSA contributions must stay within an annual limit determined by the IRS, which is $4,400 for an individual or $8,750 for a family for 2026. An additional $1,000 contribution can be made for those over age 55. Note that HSAs can only be used with what are called high deductible health plans or HDHPs. The IRS determines the limits for what constitutes a high deductible health plan. It is related to the deductible and out of pocket amounts associated with the plan. The lower limit of the required minimum deductible for a high deductible health plan varies from year to year. In 2026, this is $1,700 for an individual deductible and $4,300 for the family deductible. So, for example, in 2026, a plan would have to have an individual deductible of at least $1,700 to be considered a high deductible health plan. HDHPs also have a different maximum out of pocket limit than non high deductible health plans. The most that a maximum out of pocket cost can be for a high deductible health plan in 2026 is $8,500 for an individual and $17,000 for a family. This is different than the highest allowable max out of pocket for non high deductible health plans. Health reimbursement arrangements, or HRAs. A health reimbursement arrangement is an employer funded spending account from which employees are reimbursed tax free for qualified medical expenses up to a fixed dollar amount per year. Unused amounts may be rolled over to be used in subsequent years. HRAs are sometimes called health reimbursement accounts. The employer, not the employee, funds and owns the account. These funds remain with the employer upon an employee's departure from the company. A key difference between HRAs and FSAs or HSAs is that HRAs can be used to pay premium costs. Healthcare coverage is really complicated. It can help to start by figuring out what your needs and options are. Think about what types of coverage are available to me. Is the plan an HMO, a PPO, or another type of coverage? Does the plan have a flexible spending account or FSA, health savings account or HSA, or a health reimbursement arrangement or HRA attached? The bottom line for most of us is the cost. To live within our budgets, we have to look at the numbers. I know, math, right? Bear with me. I'm going to make this as easy as I can. We also have tools on our website to help. Let's walk through an example. Let's examine Plan A. In the first column, you can see that the premium contribution for this plan is $242.78 per month. The next column shows the total annual premium cost. That's $242.78 times 12 months. Under the medical deductible column, you can see that you would have to pay $3,250 out of your pocket before the insurance kicks in. For medications and other pharmacy expenses, you'll first need to cover the $200 pharmacy deductible before your insurance pays for those services. The total deductible column represents the combination of the medical and pharmacy deductibles. Note that not all plans have separate medical and pharmacy deductibles. The out-of-pocket maximum is the most you'd be required to spend out-of-pocket for covered in-network healthcare costs in addition to premium expenses in a plan year. Once the in-network out-of-pocket maximum is met, your insurance plan must cover 100% of all remaining covered in-network expenses. Note that there are separate columns for individual and family deductible and out-of-pocket maximums. In this example, we will be using figures for an individual policy, but you'll want to use whichever applies in your situation. Annual exposure is the most you could pay in a year for your covered healthcare costs. The total annual exposure column combines the total annual premium costs with the out-of-pocket maximum for the most you could pay in a year. So you can see that the total annual exposure under this plan would be $12,363.36. A major point to keep in mind: if you have an HMO, odds are that, except for emergency care, out-of-network services will not be covered at all. If you have a PPO or other plan that does offer out of network benefits, the deductible and out of pocket maximums for the out of network care will invariably be higher. On the spreadsheet, you can see that plans A and B do not offer a health savings account or HSA. Now let's look at Plan B in this chart. The premium costs are greater than for Plan A at $442.08 per month. However, we can see that the deductibles are lower. You will need to spend $1,000 before your insurance pays for medical costs, except for preventive care, and $150 for pharmacy costs. This makes the total deductible obligations lower. The maximum out of pocket expense is capped at $7,000. Furthermore, compared to Plan A, if you wound up needing a lot of medical services, the total amount that you could have to spend in a year is a little less at $12,305 as opposed to $12,363. You can see as well that this plan doesn't include an HSA. Plan C has the lowest monthly premium at $139.38. But you can see that at $7,000, the deductible is much higher than the other two plans. Plan C also doesn't have a separate pharmacy deductible. Continuing with our columns, the out of pocket maximum is $8,000 for a total annual exposure of $9,673. This is much less than the total potential cost of Plan A and B. Another perk, Plan C can be paired with an HSA, resulting in further cost savings. So, Plan C has the lowest total annual exposure, even with the much higher deductible. Compared to Plan A, the annual premium savings are $1,241, and compared to Plan B, you would save 3 times as much at $3,632. When you include the out of pocket maximums, the total amount saved with Plan C compared to both Plans A and B is about the same, $2,600. There's also another important factor to keep in mind. The money you spend on premiums is gone, whether you have any medical costs during the year or not. Also, the out of pocket costs are theoretical. You may or may not spend this money. Another way to think about it is that for Plan C, the known costs are $3,632 less than for Plan B. Even if you wind up spending the maximum amount, it will still cost you about $2,600 less for the year than Plan B, and you can have an HSA. To summarize, Plan A is between Plan B and Plan C in terms of monthly cost, but the deductible or the amount you have to spend before the insurance carrier starts paying for your care is higher than Plan B and lower than Plan C. Plan B is the most expensive per month, but it has a lower medical deductible and out of pocket maximum than both Plans A and C. Plan C has the lowest monthly cost, but has the highest deductible. Nonetheless, if you use a lot of medical services, it has the potential to be the least expensive over the duration of the plan year. Additionally, it also offers the advantage of an HSA. When picking out your healthcare coverage plan, here are some simple reminders. Compare plans based on cost alone only if benefits such as the provider networks and health savings accounts are the same among plans. Otherwise, you'll want to consider the relative advantages and disadvantages of these other factors. If you choose a high deductible plan or one with a high out of pocket maximum, it's really important to put aside funds to pay for those costs. If this type of budgeting is a challenge for you, you might be better off with a plan that has a higher premium but lower costs at the time of service. Depending on your health needs, budget, and whether you prefer the option to save with an HSA, one of your options might be a better fit for you than the others. And remember, you got this. Now I'll show you where to find the spreadsheet tool for your decision making. First, head over to asclepiusinitiative.org, as you can see here on the screen, and then select Educational Materials from the drop down menu. Select Types of Healthcare Coverage and then scroll to the bottom of that list and click Comparing Healthcare Coverage Plans. Once you're on the Comparing Healthcare Coverage Plans page, scroll down until you see the free download section. Just click the link to grab your copy. Rest assured, since you are downloading the spreadsheet onto your own device, the Asclepius Initiative is not collecting or storing any of your personal information. It's a great way to see your options side by side, and the best part, it does all the math for you. Thank you for attending our session on comparing plans. Last step, please take our survey. It helps to show our funder that people are using this material and increases the chance that we will be able to continue to provide useful information on healthcare coverage in the future. If you are interested in staying up to date with the Asclepius Initiative, there's a lot of great information that we share on our monthly newsletter. Feel free to scan this QR code to sign up for that. We don't do anything with your information other than send you a great newsletter every month. You can follow us on the following social media sites. We're on LinkedIn, Facebook, Instagram, Blue Sky, and YouTube. If you need more information, we have you covered. You can go to asclepiusinitiative.org/toolkit or scan this QR code. We have a lot of amazing free resources on our website, and I encourage you to check that out. I want to thank the Kentucky Department for Public Health and their grant that lets us bring this information to you at no charge so that people like you and me can get the resources we need to better understand our healthcare coverage.